and they also provide treatment to all kinds of problems from common cold, illness to special services. At the village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illnesses and they work under the supervision of doctors at the PHC, that is Primary Health Center. Such a center covers many villages in a rural area. So all these small rural areas, they come under the PHC. At the district level is the district hospital that also supervises all the health centers. Now the health service is called public. Why? Why do we call it the public health facilities? It's for many reasons. In order to fulfill its commitment of providing health care to all citizens, the government has established these hospitals and health care centers. Also, the resources needed to run these healthcare services are obtained from the money which we people pay as taxes to the government. Hence, such facilities are meant for everyone and they are called public health facilities. One of the most important aspects of the public health system is that it is meant to provide quality health care services either free or at a very low cost, so that even the poor person can seek treatment. Remember, we read that there are some people who cannot afford to pay a lot of fee. So for them, this is a blessing in disguise. Another important function of public health is to take action to prevent the spread of diseases like TB, malaria, jaundice, cholera, diarrhea, chikungunya, all these diseases. And on a large scale, these are controlled by these public health services. This has to be organized by the government with the participation of people, otherwise it is not effective at all. For example, when taking up a campaign to see that mosquitoes do not breed in water coolers, now we keep seeing there are so many ads in the newspapers and TV that we need to clear off our water coolers so that breeding of mosquitoes is not there. You must have noticed. Then rooftops also, water should not be accumulated. The government tries to make the people aware of all these things on a large scale. Now, according to our constitution, it is the primary duty, rather the main duty of the government to ensure the welfare of the people and provide health care facilities for all. The government must safeguard, the government must take care of the right to life of each and every person, not only the rich but also the poor. The court said that the difficulty that Hakim Sheikh, you remember we talked about a case that had been filed by Hakim Sheikh. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. He could have lost his life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court also said that it was the duty of the government to provide the necessary health services, including the treatment in emergency situation. They are not going to wait for the bill to be paid and then take the patient in. Hospitals and medical staff must fulfill their duty of providing the first aid, the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give him the money he had spent on his treatment. Kudos. That's the way it should be. Now talking about the private health services. What do we mean by private health services? It is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds the registered medical practitioners, that is the RMP. Urban areas, that is the cities, we have a number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many labs and they do the tests and they offer special facilities such as X-ray, ultrasound, etc. There are also shops from where we buy medicines. Now, as the name suggests, the private health facilities, these are not owned or controlled by the government in any way. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. And the bill depends upon the doctor. Today, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals and some are engaged in manufacturing and selling of medicines as well. Medical shops are found in each and every remote corner of the country. Now, this is all about the private and the public health services. Now, sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Women, for example, are not taken to a doctor in a proper way. Women's health concerns are considered to be less important than the health of men in the family. Many tribal areas have few health care centers, and that also they do not run properly. So, what can be done? There's little doubt that the health situation of most people in our country is really not good. It is the responsibility of the government to provide quality health care services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on the basic amenities and the social condition of the people as it is on health care services. Hence, it is an important work. Hence, it is important to work on both in order to improve the health situation of our people, and this can be done. For example, if we talk about Kerala, let us see what happened there. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to the panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development, and education. This meant that water supply schemes were checked. The working of schools and Anganwadis was ensured, and specific problems of the village were also taken up. Health centers were improved, obviously. When the panchayats have been given so much money, they started improving all these facilities. All of this helped to improve the situation. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and these needed to be addressed. But on the whole, a lot of improvement took place. Taking another example of Costa Rica. Costa Rica is considered to be one of the healthiest countries in South America. Now, what is the reason? The main reason for this can be found in the Costa Rica Constitution. Many years ago, Costa Rica took a very important decision and decided not to have an army. This helped Costa Rica government to spend all the money that they had to spend on the army, on health, education, and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to the health of its people. So that's all in this lesson, Role of Government in Health. Thank you so much.